Good afternoon, everyone. Thank you for joining us. My name is Claire. I'm a contract librarian on assignment here with NOAA Central Library, and I'll be your host this afternoon. This seminar series is offered through the NOAA Central Library Seminar Program, which provides an educational forum for the presentation of ideas, research updates, and news in support of NOAA's mission. This is part 4 of a 5-part series. The next part in the series is yet to be announced. Before we start, I have a few technical tips for attendees. Just so you're aware, you are muted and you're not able to unmute. However, if you have a question, you can type it into the question panel and we will get to those during the Q&A session at the end of the presentation. If you're having any audio or visual issues, if you can't hear the speaker or see the slides, please try logging off and logging back on, and that will solve most issues in GoToWebinar. And just as a reminder, this is being recorded. If you'd like to revisit this seminar or view previous seminars, you can find them on our YouTube channel. Now I'm going to turn it over to Lisa, who's going to get the presentation started.
Well, hey everybody, and welcome to the 4th in a series of 5 webinars, as Claire mentioned. I want to welcome Cynthia and Forrest. We've worked together on a lot of cetacean issues over the years, and you guys are going to love this talk. I've been looking forward to this for a while. And just as a little bit of an overview, I just wanted to let you know and remind you that all of the previous sessions are available on the web, as Claire mentioned, and this one is being recorded and will be available also. And the 5-part seminar series is really all about talking about, the oil spill impacts to cetaceans during and in the wake of the Deepwater Horizon. The series of studies were undertaken, and we've been reporting them out in sequence throughout the course of the last several months. So we've got 2 to go, and I won't take up a lot of people's times. When you're not here to listen to me talk, you're here to listen to these doctors talk about the results of some reproductive studies that they've done. So without further ado, take it away, you guys.
Oh, can you hear me okay? Yes?
Yes.
Okay, great. All right, thanks. Thank you so much, and thank you for inviting us to be part of this seminar series. We're really looking forward to sharing the results of our study with you. So today, representing this big body of work, it's myself and Dr. Forrest Gomez. Forrest is a conservation medicine veterinarian that specializes in marine mammals, and she currently serves as our director of medicine at the National Marine Mammal Foundation. And I am serving as the executive director and chief medical officer for the foundation. So it's really a pleasure to be presenting to you really a decades-long effort with so many wonderful people that have been a part of this. So let's get started. So I just want to start by acknowledging the co-PIs on this project, Drs. Lori Swacky of the Foundation, Terry Rolls of NOAA, and Katie Colgrove of the University of Illinois. They helped co-lead this reproductive investigation and really helped assemble this veterinary and scientific team. There are a lot of people that were involved, and these are the people that were actually involved in the acquisition of the data and the interpretation of the data. We had more than 12 organizations, including nonprofits, government agencies, veterinary hospitals, zoological societies, and academic institutions. So it was really just quite the effort with a lot of people and also a lot of volunteers that were helping us out. Okay, so as Lisa reminded us, the topic of today's seminar and of the series is the Deepwater Horizon disaster. So we're going to just spend a minute or two just remembering what actually happened, and so that we can create that context for what we'll be walking through today. So the explosion of the drilling platform in April 2010, the collapse of the rig, and then the subsequent flow of oil resulted in millions of barrels of oil being released into the northern Gulf of Mexico. And oil spread to more than 1,000 miles of the Gulf Coast from western Louisiana to the Florida Panhandle. The surface oil footprint, which can be seen here in the satellite image from NASA, overlapped with the known ranges of 21 species of dolphins and whales in the Northern Gulf. Thousands of animals were documented swimming through oil with no evidence of avoidance. So there were hundreds of scientific studies, as you all know, that have been conducted as part of NOAA's Natural Resource Damage Assessment, which was aimed at determining the appropriate type and amount of restoration needed to offset the negative effects of the spill. Wildlife studies have focused on multiple species, including shellfish, corals, birds, sea turtles, and today's topic, marine mammals. So as a result of the comprehensive NERDA investigation, adverse health effects were well documented in dolphins impacted by the oil spill. And we've been walking through that over the course of the seminar series. And these include poor body condition, moderate to severe lung disease, adrenal system injury, and perinatal loss. And when I say perinatal loss, I'm referring to either fetal loss or neonatal loss. So perinatal is just around the time of parturition. So we're talking about the loss of the fetuses either through an abortion or a stillbirth, or an early neonatal loss. So soon after the parturition, the baby died. So perinatal loss is the focus of today. All right, so we're going to, you can dive into all the publications if you want to go back and refresh your memories on the adverse health effects, or if you're just learning about them. There's a wonderful body of literature now that is detailing all of these adverse health effects. And I say wonderful, also tragic, of course, but there is a good amount of literature available too. And that was just a snapshot of some of the publications that walk us through that. Okay, so during the NERDA study period, a high rate of reproductive failures was documented in bottlenose dolphins, and specifically findings from both the live and the dead animal studies confirmed a low rate of reproductive success, with only about 20% of the pregnancies actually being successful from heavily oiled estuaries when we compared them to other dolphin populations throughout the southeast region. And during that study period, we did not see any evidence of recovery. The potential etiologies of failure included poor maternal health, which we had documented, and was due to moderate to severe lung disease in the animals and adrenal gland injury, which contributed to their impaired stress response. And these things can actually put pregnancies at risk. We also considered increased susceptibility to infection, which was documented by Dr. Sylvain de Guise in his immunology investigations. And then we also considered that this could be a direct effect of the oil and exposure to the developing fetus or the reproductive organs of the dam. But at the end of that study period, when the NERDA ended, we knew we had a picture of reproductive failure, but we did not know exactly why it was happening. So once that study period wrapped up and the NERDA was completed, we set out to secure funding to continue our investigation into the high reproductive failure rate. And in 2016, we were able to successfully secure funding from the Gulf of Mexico Research Initiative to launch a multi-institutional collaboration in partnership with NOAA and the US Navy, which will become more obvious in a minute. And we aimed the project at determining the mechanism of reproductive failure. So the primary objective of that GoMRI-funded study, and that is going to be what we focus on today, was to advance our methods for evaluating dolphin fetal, placental, and maternal health, and then apply those techniques to investigate the potential mechanisms of failure. Our research approach was three-pronged. First, we wanted to develop innovative methods to further investigate fetal and maternal health in well-studied managed dolphin populations. So this is something where there's a large amount of data, clinical data, observations, ultrasound data that's available. And so we really knew that we could dive in pretty deep into the managed dolphin data set. We then wanted to apply our enhanced methods and the knowledge that we learned from the managed animals to the Barataria Bay dolphin population, and utilize those techniques and methods to evaluate fetal, placental, and maternal health. Now, this would be not as, I won't say easy, but it's certainly going to be more challenging than working with the managed animal data, because with Barataria Bay dolphins, we typically have a moment in time, a snapshot, and we need to learn as much as we can quickly so that we can understand exactly what's going on with an animal's pregnancy and what the chance of survival for that neonate or fetus might be. And finally, we would assess the potential mechanism and timing of the failures in Barataria Bay by comparing their failures and their clinical pictures to known cases of failure in the managed dolphin populations. And we wanted to compare the diagnostics and the histologic lesions that have been documented to help provide context so we could really understand this equals that kind of thing. So we really wanted to understand if we saw something in the Barataria Bay dolphins, then what could it mean, and rooting that and grounding that information in everything we could get out of the known cases of failure from the managed dolphin side of the house. So we're going to start at the top and walk through our development of the new techniques. And we focused on 3 different things. The first one was enhanced reproductive ultrasound, and that is the bulk of the investigation that we're going to present today. It was really the mother lode of it provided way more data than we actually thought it was going to. So we got a lot out of it, and we're going to spend some time on that today. And then we also focused on maternal oxygenation status and blood-based indicators. So we'll touch on those too, but we're really going to dive deep into the ultrasound to share with you how much we can actually learn and how much we did learn from enhancing those techniques. So this is where I'm going to turn it over to Forrest, to Dr. Gomez, so that she can walk you through the ultrasound portion of the study.
Good morning, everyone. Can you hear me okay, Cynthia?
I sure can.
Okay, great. Well, thank you. I just also wanted to say thank you for having us speak today. And like Cynthia mentioned, I'm really going to walk through ultrasound with all of you today, and I'll try to explain what you're seeing in case you're not familiar with the modality. So as she mentioned, we enhanced our reproductive ultrasound techniques by working with animals that live in managed care. In this setting, extensive health histories are known about each individual animal, and regular pregnancy monitoring occurs. We selected 16 pregnancies in human care with known successful outcomes, and then we had 22 pregnancies with failed outcomes. Altogether, we reviewed 517 exams and more than 70 ultrasound parameters for each exam were looked at. Next slide, Cynthia. Perfect, thank you. As a result of all of this extensive work and effort, we were able to establish a standardized kind of refined technique for each trimester of pregnancy. And this was published as an illustrated guide for evaluating both the fetus and the placenta. These are some lovely illustrations that my colleague, Dr. Veronica Sendejas, our hospital manager, produced for us, which really show the changes that we see via ultrasound by trimester. Okay, Cynthia, next slide. We further were able to refine techniques that we've used for quite a while for evaluating fetal growth to include the skull biparietal diameter. This is a really essential technique that we use regularly. It allows us to calculate estimated due dates, figure out which trimester we're in and about when the pregnancy should be complete. On the left side, you'll see a 3D CT reconstruction of a dolphin skull, and this is showing the plane in which we are able to measure that biparietal diameter. And the other two images in the middle and on the right are ultrasound images of dolphin fetal skull measurements. So I'm going to actually take a minute right now because we're going to start looking at a lot of ultrasound just to orient you to the images. So starting with the one in the middle, from the top down to the bottom of each image, we're moving from the outside of the dolphin to the inside of the dolphin. And each image represents a very thin slice of tissue. The middle image is showing a cross-section through a fetal skull, which is being measured with the dotted line right there in the middle. And then on the right, what you're looking at is the blubber layer is at the very top, that white line at the very top of the image. And then as you work your way down, we're moving through the muscle layers and into the uterus of this animal. And then inside the uterus is the dolphin fetus, which you can see right there in the middle. The ribs are pretty apparent, as well as the skull, the chest cavity, and then that same biparietal measurement is going across the skull. Okay, next slide. We did add some additional measurements for fetal growth to our overall assessment, including changes in thoracic diameter or chest diameter over time. And this can be seen between the white arrows in each of these images, just from different angles. Next slide. We also evaluated changes in aortic diameter, which is what you see in the image labeled B on the left, in between those two arrows, as well as the fetal blubber thickness, which is seen in the right image in between the two arrows. Next slide. From our evaluation of these successful pregnancies in managed care, we were able to establish fetal growth curves for the thorax, the skull, the aorta, as well as the blubber layer. Next slide. And again, all in all, there were, in addition to what I just walked through, more than 60 other parameters that were measured. And one of them, which became apparent throughout our study as we expected, very important, is the ureteroplacental unit. And that changes with anatomical location as well as by trimester. And the ureteroplacental unit, just to explain it a little further, is made up of the layers of the uterus and the placenta. They sit really close together during pregnancy, and when measured together, we refer to it as the ureteroplacental unit, or for short, the UPU. You can see it here in between the white arrows and the images to the right of your screen. These images show not only the 3 different locations that we routinely take measurements from now, but also a little bit of the changes over time. Next slide. And for those that are interested, we have published this, and you can read more in our 2019 publication in Veterinary Radiology and Ultrasound. This describes our refined ultrasound technique for pregnancies, the growth parameters, and the most common ultrasound findings that are associated with normal pregnancy. Next slide. So then our next step was to apply these same evaluation techniques to unhealthy or failed pregnancies, again, in this managed care setting first, in order to help identify the most common ultrasound findings in these failed cases. Altogether, we evaluated 22 reproductive failures over a 24-year period, and we were able to detect fetal placental abnormalities as early as the first trimester. It's important to note that reproductive failures are not that common in this setting. The healthcare is so advanced. And that is why we had to pull from 24 years, the study period had to span that long in order to collect enough data. Next slide. The most common ultrasound findings in these reproductive failure cases, the most common one was an abnormally appearing UPU, or ureteroplacental unit, which was diagnosed in 81% of the failed cases. The underlying etiologies of failure were determined through a comprehensive analysis of each animal's clinical history and diagnostic test results throughout the pregnancy and even before the pregnancy, as well as histopathologic findings from recovered placentas when they were available, as well as the fetus and or neonate. In cases of abnormal UPUs, the underlying etiologies that we did tie to this finding included maternal illness, both infectious as well as non-infectious, placental dysfunction, and congenital abnormalities. Next slide. Abnormally thick UPUs were seen in 76% of the failure cases in managed care, to include brucella positive cases. You can appreciate the difference between the normal ureteroplacental thickness on the left, indicated by the white arrows, and then on the right hand side of your screen, the thickened UPU looks very, very different. And this is actually measuring greater than 1 centimeter. And this is a case of brucella placentitis. Next slide. A large corpus luteum was seen in 45% of the failure cases. This finding is a bit of a conundrum, honestly, as it was an unexpected finding. We're still trying to figure out, and we're still investigating the possible causes, which could include an abnormal CL growth or corpus luteal growth as a compensatory mechanism for a poorly functioning placenta, which again, we've seen in a lot of these cases. It could be evidence of an infection of the ovary or potentially cysts, but we feel this is less likely as we regularly document cysts in dolphins, and they were not observed in these specific cases. Next slide. Maternal peritoneal effusion, or free fluid in the abdomen, which is abnormal, was seen in 21% of the failure cases and was found in animals with maternal illness and placental dysfunction, but was not observed with congenital abnormalities. The white arrow is pointing to a pocket of free fluid, that black pocket right there, that triangle, and in one of our females' abdomens. Next slide. Placental separation was detected in 19% of the cases, although it's our suspicion this may have been underdiagnosed, as abortion will often follow very quickly once separation happens. The video on the right is showing separation between the uterus and the placenta, those two different organs, and this animal aborted within about a week. Next slide. We also detected excessive umbilical cord coiling, although it was less common. And the image on the left is showing a healthy cord exiting the fetal abdomen, as indicated by the arrow. And then the image on the right is showing a coiled cord right there. Okay, next slide. We also had a single case of thin UPU, or ureteroplacental unit, which was confirmed as villus hypoplasia on histopathology. This is a common finding in equine reproductive losses, and so we have paid special attention even though it was only seen once. And this is often correlated with nutritional disorders. Next slide. Okay, this slide walks you through the comprehensive analysis that was conducted for each of these pregnancies. This was an essential step because we know so much more about the cases in managed care. So we started with what is already known about these dams, such as who they are really, how old they are, how many pregnancies have they had, etc. And then we integrated that with what was known about their individual clinical history, as well as what was known about their environmental or exposure history, which for these animals was minimal to none. And then we integrated this refined ultrasound, the findings from the refined ultrasound technique, and combined that with newly developed techniques to evaluate maternal oxygenation and pregnancy blood work, which Cynthia will cover in just a minute, in order to help elucidate suspected causes of fetal loss and underlying etiologies of pregnancy failure. This was our mechanistic framework for pregnancy evaluation, with histopath honestly being essential to help ground our hypothesis. From this analysis, we did designate 6 causes of fetal loss and 4 underlying etiologies of pregnancy failure. They're listed on the right-hand side of the screen. Since we do not have as much histopathology with the wild dolphins, these cases were very valuable in trying to piece together what happens when a pregnancy fails. Next slide. Maternal illness was unequivocally the most important underlying etiology and was diagnosed in 68% of the cases overall, 8 of which were infectious and 7 were non-infectious. Placental dysfunction was determined as an underlying etiology of failure for 23% of the cases, and congenital malformation for 9%. Next slide. When determining the potential cause for each of loss for each perinate, fetal hypoxia was found to be the most common cause of loss at 50%, followed by fetal and neonatal infection at 36%. Congenital malformations were much less common as expected, and the cause of death for one of the cases we were not able to determine. Next slide. To wrap up this portion of the study on the managed care animals, the takeaway is that we were able to develop an advanced ultrasound technique for pregnant dolphins and detect fetal, placental, and maternal abnormalities as early as the first trimester. And this helped to determine the cause of reproductive failures in each of these cases. Next slide. And so this brings us to the next step in our approach, which was to apply these enhanced methods to Barataria Bay dolphins and evaluate for fetal, placental, and maternal health. I'll turn it back over to Dr. Smith.
Okay, awesome. Thanks, Forrest. All right, so now we're going to really start focusing on the Barataria Bay dolphins. So let me just get reoriented here. All right. So once the protocols and indicators were established with dolphins in a managed care setting, we could move on to wild dolphins living within the oil footprint. And during the capture release health assessments that were conducted from 2011 to 2018, so both during the NERDA time period and the GoMRI-funded investigation, we examined 44 pregnant dolphins in Barataria Bay. So in order to determine if the pregnancy outcome was successful, our field team performed boat-based reproductive surveys that were timed carefully with the dolphins' expected due dates. So Forrest showed you how we can actually measure that fetal biparietal diameter, and then from that we can calculate an expected due date, and it's typically within 2 weeks, plus or minus 2 weeks, that the baby will then be born. So we can time the photo ID and reproductive surveys based on those expected due dates. A pregnancy was deemed successful if a neonate was sighted, and it was deemed unsuccessful if no neonate could be found in the weeks to months following the expected due dates. We wanted to make sure to go pretty far after that, that due date, just to make sure that in case she was late, that we didn't mischaracterize anything as a failure. So of the 44 dolphins that were diagnosed pregnant, 7 could not be found, and so we could not determine whether or not those animals had reproductive failures or successes. Unfortunately, we do think some of those 7 dolphins died, but again, we could not, since we couldn't assign reproductive success or failure to the pregnancy, we had to remove them from this portion of the study where we were really focusing on the outcome. So of the 37 dolphins that remained and were sighted and we could determine the outcome, 28 of those pregnancies resulted in a failure, and only 9 were successful. So now we're going to dive into what did we actually see in Barataria Bay in those pregnancies. And we can, now that we had outcome, we could compare the abnormalities that we saw in the failed pregnancies versus the successful ones, just like we were doing in the managed animal setting. So the most common abnormality diagnosed in failed pregnancies was this abnormal uteroplacental unit appearance. And that's, if you, as Forrest showed, that's where that placental, that UPU gets rough and a little bit wavy and thick. And so it's very clearly different than what we typically see in these healthy pregnancies. So more than half of the pregnancies that failed had an abnormal UPU appearance, and that's compared to only one of the successful cases in Barataria Bay had that finding. Additionally, we detected large CLs, thick UPUs, which is indicative of placentitis, maternal peritoneal effusion, and placental separation. And you can see that we didn't detect those abnormal findings in any of the successful pregnancies from the wild dolphin data set. And then finally, excessive umbilical cord coiling was rarely seen and wasn't considered that meaningful, at least not with this, with the small number of cases that we actually diagnosed it in. And so we're not placing a lot of emphasis on that at this point. So overall, as clinicians, we're now really focusing on these changes that we're seeing in the placenta, that abnormal UPU, the thick UPU, the thick uteroplacental unit, and placental separation. And that placental separation, that is a very strong indicator of a failure in the veterinary world. And so not specific to dolphins, although it's proving to now be important for dolphins, but especially in horses where this is really watched for, as that if the placenta starts to separate from the uterus, that is a bad sign. So the fact that we actually caught it in 4 of these 23 cases, that we could actually assess the placenta and the potentials for separation, that's actually quite remarkable that we were able to catch it with just a single snapshot into that pregnancy. All right, so if we dive a little bit deeper and really start to focus on these placental changes, we did see that 64% of the pregnant Barataria Bay dolphins that had a negative reproductive outcome did have evidence of some kind of placental abnormality or placental dysfunction, whether it was an abnormal appearance or a thick UPU or potentially separation. And we were seeing this as early as the first trimester. So that was again compared to only one of the cases where we saw an abnormal UPU appearance in the successful pregnancies. So really, again, focusing on the placental changes, and this will be something as we move into the future that will continue to be important to focus on. So the last piece of ultrasound data we'll share, we could talk about ultrasound all day, but we won't, is the part that involves fetal pulmonary health. And so this was actually included in our original study that Dr. Ivanchich published, and Forrest mentioned is published in Veterinary Radiology and Ultrasound. So for those that are interested, you can go find this. But Dr. Ivanchich, who's a veterinary radiologist focusing on marine mammals and other wild and zoo animals, she turned us on to this concept of looking at the lung to liver ratio as a way to potentially pick up fetal pneumonia or fetal distress. And so what we're looking at, and when I talk about the ratio, what we're comparing is the brightness or the mean pixel intensity. You can calculate that with a software program, the mean pixel intensity difference between the lung and the liver. And so if we're looking at these images here, the one on the bottom, it's pretty clear, I hope, that we're looking at the fetus, a dolphin fetus inside the uterus. So again, just to reorient you as Forrest did, we're going from outside in. So we're looking here at the blubber layer, and then we're going through the muscle layers here, and now we're entering this animal's uterus. And here's the baby. And then we can see the lung field here, and it's got a pretty bright appearance to it. And then the liver is right next to it. So we can make that out here. And basically what we're comparing is the echogenicity, or the brightness, between the two. And we found from evaluating successful pregnancies, specifically the managed dolphin successful pregnancies, that we should get a ratio of about 2.5. And then variations in that ratio can actually signal a problem, and could even, at least in humans and in other animals, can signal the presence of in utero pneumonia. So that would be quite remarkable if we could actually diagnose it, because during the Deepwater Horizon investigation, specifically the dead animal side that was being led by Katie Colgrove and Stephanie Ben Watson, they were finding that the animals that were washing up, the carcasses that they could actually recover and investigate, had a high prevalence of fetal pneumonia. So we were trying to figure out, is this something that we could actually diagnose in utero? And so there's a lot of promise with this specific data interpretation. So I'll just show you a quick example of what this could look like. This is an example of an abnormal lung to liver ratio in a dolphin fetus. The image on the left is the normal one that we just looked at. And the image on the right, you can see there isn't that much of a difference between the brightness in the lungs, which are here, and the liver. And so when you do the mean pixel intensity comparison, the ratio is only about 1.45. And so this is lower than our 2.5 standard, and it's possible that what we're seeing here is indicative of fetal distress and pneumonia. And this pregnancy did fail. But unfortunately, there's just not enough data on this for us to make some strong conclusions. So we're further evaluating this specific ratio, but we are encouraged that this might be something that could really help us in the future to help diagnose fetal pneumonia in utero. Okay, so in addition to ultrasound, so we're gonna wrap up the ultrasound part and move on, and I'm just gonna quickly share with you some more information on the maternal oxygenation status study that we did, as well as blood-based indicators. So we focused on maternal oxygenation because we wanted to determine if the high prevalence of pulmonary disease that we were seeing in Barataria Bay dolphins could be negatively impacting the fetus and contributing to reproductive failure. And specifically by creating an environment of low oxygenation and potentially leading to fetal hypoxia. So we're trying to figure out how can we actually get an answer or some more information on the maternal oxygenation status of these females. So we started by collecting paired blood and exhaled breath samples from dolphins with and without lung disease, as determined with ultrasound evaluations, from both managed and wild dolphins. And we found that animals with moderate to severe lung disease did have high blood bicarbonate concentrations, pH, and more positive base excess than animals with normal to mild lung disease. So when you're considering these kinds of changes in the context of the comprehensive health evaluations of these Barataria Bay dolphins, the data was suggesting that the animals have a chronic respiratory acidemia with compensatory metabolic alkalosis that could be present in these Barataria Bay dolphins with moderate to severe respiratory disease. And so basically it was just starting to build some information in a case that we actually were having an acid-base imbalance, and this could be negatively impacting not just the mom, but if there was a baby on board, also that developing fetus. So I'm not going to go that much more into detail on that. There's a pending publication by Sarah Sharp, who led this part of the investigation. And so hopefully you'll be seeing that out soon. Now I'm going to switch to blood-based indicators. So we also wanted to know how far can we take a blood sample in helping us determine or predict whether a pregnancy would be successful or if it would fail. So we began this portion of the study by investigating or by evaluating the routine blood profiles of pregnant dolphins in human care and establishing baseline values for healthy versus failed pregnancies. And we also expanded our reproductive hormone analysis, looking for additional indications of failure. So this is also pretty straightforward, and we're not going to get that much into this part of the investigation, but I will point you to two different publications that were published by Dr. Ashley Baraclough. And one covers the blood work profiles of successful pregnancies in managed care, and that was published in Theriogenology. And then she also published this year the blood work profiles of reproductive failures, so that we can, as clinicians, really start to look for those indicators and predictors of potential failure. And that publication can be found in the Diseases of Aquatic Organisms. All right, so we then evaluated those same blood-based indicators in pregnant Barataria Bay dolphins. So again, we were taking and creating as much information as we could from the managed dolphin cases, and then taking that and applying it to Barataria Bay. And we found that anemia and inflammation were indicators of reproductive failure. And we had seen this in our preliminary data, and it was also emerging in that in the managed animal cases, and then we also saw it in the Barataria Bay wild dolphin cases. So in addition to the blood work findings that were being revealed in this way, we were also using the blood work and any abnormalities in their blood chemistries to help determine the cause of the reproductive failure. So the blood and the maternal oxygenation and the ultrasound were all spilling over into the final step in our process. So let's get to that next. All right, so the third and final prong of our research approach was to assess the potential mechanism and timing of Barataria Bay reproductive failures by comparing everything we learned from them and all the data collected on them in that snapshot of time, and comparing it to the diagnostic and histologic lesions from these archived cases of perinatal loss in managed animals. And so we were really trying to create a context that we could take the findings from these Barataria Bay exams as far as possible. And so that was the final step. So this final step involved integration of all of that data. So the ultrasound data, the comprehensive health data, which, as I mentioned, included maternal oxygenation measures and blood values. And we took all of the data from both the successful and the failed pregnancies, from managed dolphins and from wild dolphins. And then we also utilized the reproductive outcome and when it could be recovered. And this was specific to the managed animal cases, the placentas, and then carcasses from failures, so that we could really help elucidate the mechanisms and etiologies of failures. So this was a very large data set that has taken a lot of time and integration, but we were able to take it pretty far. So let me share with you now what the key findings were from this overall comprehensive investigation. All right, so the findings from that process included, let's start with the overall health data. So in the context of the overall health data, 96% of the pregnant Barataria Bay dolphins that had a negative outcome, that had a failure, had evidence of maternal illness. So 27 of those 28 dolphins were sick. And we compare that to only 25%, of the dolphins that had successful outcomes had diagnosed maternal illness. So clearly maternal illness is part of the picture here. And then in terms of the potential mechanisms of failure, 65% of the pregnant Barataria Bay dolphins had ultrasound that had a negative outcome, had ultrasound evidence of placental dysfunction as early as the first trimester. And in addition to that, pulmonary disease, we do think was likely contributing to the acid-base imbalances and may have contributed to low-grade sustained fetal hypoxia. Now, this one is a little bit harder to actually conclude and really lock in. So this is one that we're going to continue to focus on because, like I said, it's basically pulling all the data together and trying to put all the pieces of the puzzle together. But it does look like we likely had this pulmonary disease contribution, this acid-base imbalance created, and then the potential for a sustained fetal hypoxia, and that could be part of these failures. So in summary, this low reproductive success rate is continuing in Barataria Bay. So we're still at about, over the course, and it hasn't changed much from year to year, we're at about a 24% success rate overall. The most likely cause of failure in the Barataria Bay dolphins is maternal illness, and there's a strong evidence of placental dysfunction. The chronic respiratory disease, we are considering a contributing factor with evidence of metabolic alkalosis, which came out in those blood gas and maternal oxygenation studies. And there's continued impaired stress response in these animals, and this is part of a different seminar series, but there's an ongoing adrenal injury or adrenal compromise that we've been documenting in these animals. And there's concern about an impaired stress response when an animal goes into labor. And we know that pregnant animals with untreated adrenal compromise are at risk of losing their pregnancies during parturition, and actually, if gone untreated, in which these in the wild they would go untreated, there's actually a risk to the female herself and to her ability to survive parturition. And so we are very concerned about this ongoing impaired stress response, which was tied back to the Deepwater Horizon oil spill and the potential for exposure there. And then finally, the success rate of these pregnancies is not expected to improve because of the link to maternal illness until the health of the dams improves. And this is something that Dr. Lori Schwacke and Len Thomas walked us through in the last seminar series, and or maybe 2 series ago, and are really trying to help us understand, what is actually happening in Barataria Bay. And it looks like at a minimum, things are the same, and potentially the health of the animals is getting worse with time instead of better. And so we do not think that the reproductive success rate will improve until till the health of these females starts improving. So the final conclusions of this project are that the GoMRI investigation and the GoMRI investment in marine mammal science vastly improved our ability to evaluate maternal, fetal, and placental health in dolphins. And these are considered a sentinel species in coastal ecosystems. So we really appreciate that investment. And we're really grateful to be sharing the science with this community and making sure we do the most that we can with it as we apply it to other cetaceans at risk. We have evidence of a sustained high reproductive failure rate in heavily oiled Barataria Bay, and there is currently no evidence of recovery. We have documented chronic health issues within the oil spill footprint, and then we still we don't have evidence of, or strong evidence, I should say, of individual animal recovery. And then the health monitoring of both the live and the dead animals really should continue to determine what are these long-term impacts and what's the potential for transgenerational effects. We're not quite far enough along. We're just starting to get there where we could actually be studying transgenerational effects. And so there's still a great deal to be learned. The fact that maternal illness is persisting, and the fact that the overall health status of dolphins in Barataria Bay is still poor means that the investigation really isn't done, and we still have a lot that we need to learn. These GoMRI studies have concluded, and so it is important for us to find ways to continue to work in Barataria Bay as a scientific community and really take as much as we can away from this important, really case study of what can happen when oil reaches and impacts a bay this significantly and this population of animals so severely. And then these compromised populations are vulnerable to additional stressors, and we've been talking about that too in this seminar series. You know, we know that these are being considered during restoration planning, and we just want to keep that on everybody's mind, that these, especially with the kinds of compromised health conditions that they have, and that adrenal gland injury is one that really comes to mind. Thinking about, if you have an impaired stress response, what's going to happen when you're faced with another stressor? And how are you going to be able to, as a creature, appropriately respond and survive that stressor? So I'll just end there and conclude by thanking the team, the investigative team over the years, and really beginning with Noah and the NERDA team that was assembled. It was just from coming from the outside and being included in that process. It was just remarkable to see how quickly and efficiently that team was assembled. And then to be able to continue it under the GoMRI umbrella and keep working with all the same folks and trying to get this work out and published and available to the scientific community. It's just been a truly, really rewarding experience, I think, for all of us involved. As difficult as it's been, it's really been just an amazing experience overall. So I really appreciate being involved, and I'm sure I'm gonna turn this over to Forrest so she can give her final thoughts too here. But I just want to thank everyone and thank you for your attention, for listening. And oh yeah, sorry, real quick before you hop in there, Forrest, just obviously thank you also to the organizations that really got behind not just their investigators, but their volunteers, as they really helped us out with all these studies. And not just under the GoMRI Repro project, but also Dr. Swacky's Karma project for advancing the research for marine mammal health assessments, and which is still going. Okay, so Forrest, if you'll come back, then I'll let you say your acknowledgements and thanks too, and then we can take questions.
I think you covered it all. I just echo everything that you said. It's a wonderful collaborative team, and it's, you know, really just been an amazing experience. So thank you for listening.
Okay.
All right, so I just want to remind everyone, you can add questions to the question panel in GoToWebinar. And I'll just give everyone about a minute for those questions to come through.
And I did put our contact information up on that last slide, so feel free to reach out to either myself or Forrest, or Lori Swacky, or Terry Rolls, or Katie Colgrove, or any of the folks that were involved in the study.
Thanks. So I'm not seeing any yet. Just give me one more minute. Oh, here we have some coming through. All right. Can you talk a little bit more about the acid-base imbalances? Does that cause the pulmonary disease, or is it a symptom of it?
Oh, did it cause the pulmonary disease, or is it a symptom of it? We believe it's a symptom. And so we looked at animals with and without pulmonary disease, and that is how we were determining basically, you know, and pneumonia is what we really focus on, but really trying to get a picture of what is the blood gas, what is normal blood gas picture, and those exhale gas picture, what should it look like, and then what happens to those blood gas variables, and what happens to the exhale gases when the lungs become compromised. So right now we believe it's a symptom. And again, like I said, Dr. Sarah Sharp, who was with us as a conservation medicine intern during the GoMRI Reproductive project. She's got the publication pulled together, and hopefully that'll be out there. She's at IFA now, very busy doing a lot of important work. And so hopefully Sarah will be getting that out, and so that everybody can take that and digest it and give us some feedback on that, on those blood gas data and that maternal oxygenation status portion of the study.
Thanks. Our next question, is there information on the reproductive success rate of the Barataria Bay dolphins prior to the Deepwater Horizon spill?
Yeah, so yes, there is some. And so if Nick Keller was here, I would ask Nick to take this. So Nick Keller and Suzanne Lane both published some papers on this topic. And so one thing that was quite remarkable was that prior to the oil, once the Deepwater Horizon oil spill happened or the explosion happened, but before oil got to Barataria Bay, NOAA deployed a team to Barataria Bay to collect biopsy samples from the dolphins living there. And Nick Keller did a wonderful study and looked at the pregnancy. We can tell a lot from a blubber sample, a lot more than I actually knew before this whole investigation started, but you can diagnose pregnancy from a blubber sample with high confidence. And so we do have the pregnancy rates and some really good pregnancy outcome data that was collected just before the oil got there. And so again, you can, Nick has a great paper out. I believe it was published in 2017. And then Suzanne Lane also has a paper out from 2015 that talks about that. But obviously, I say obviously because I know I'm speaking to a baseline loving community, but obviously we would love baseline data, for decades in all of these places where there's a likelihood of things like this to happen, which is, almost just about everywhere these days. And so that would have been ideal, but I thought it was just remarkable that that we actually were able to get some data prior to oil coming in and impacting that bay. So I don't know if anybody else, Forrest or Lisa or Terry or anybody else wants to chime in about that. Okay, but send your questions to Nick Keller on that one. He did great work.
Okay, so the next question is, have you seen compromised adrenal function in generations after the Deepwater Horizon spill?
Oh, yeah. Have we seen it? So the babies, what's going on with the babies? That's such a good question. I don't think we have enough data yet to know. So, the sample, the numbers of animals, because we are looking at animals that were alive at the time of the spill, and we're really focusing on those animals, right? And then there's animals born after the spill. What we know so far is that their pulmonary disease picture isn't as bad. It doesn't look like the animals that were alive at this time of the spill, and their overall health picture is better, which is good. And so, but I don't think we have quite enough data yet to know if we have the same kind of adrenal gland injury in those animals. So TBD on that one.
Okay, and my apologies if I mispronounced this, but has there been a change in the prevalence of brucellosis in the Barataria Bay dolphins over the years?
Yeah, has there been a change in prevalence of brucellosis? So, we talk a lot about brucella. Brucella is pretty much everywhere. It's in all the different, everywhere we've looked, it's some evidence of brucella, right? I don't think we found a population yet really is completely insulated from it. And so we did look at, and we, meaning the whole team, and really Stephanie Van Watson Katie Colgrove, Terry Rolls, we're looking at Deb Fauquier, we're looking at the Brucella picture and how much could it be a part of this? And basically, I don't know if I'm answering the question, so we might have to go back to the question, but I think this is an important point to make, which is basically we did see, I mean, there was Brucella in Barataria Bay. We were seeing some cases of Brucella infection. And one thing that was so fascinating from Sylvain de Guise's work, if you pull his paper on the immune function and the immune part of the story, it looked like the animals that were impacted by oil had this increased susceptibility to infection. And so the way he would describe it to us non-immunologists is that the oil exposure was creating a hole in the immune system and allowing things to get in, or potentially, if Brucella was living dormantly, somewhat dormantly in an animal's body, then it could kind of reveal itself and become a bigger problem. So it was creating this increased susceptibility to infection. So that's something we're considering. We don't know for sure how big of a role it is, but Brucella was very carefully looked at, and we couldn't just chalk this up to Brucella. It was more than that. And so again, I believe Deb Fauquier she definitely has some papers out on this and has helped out with the Brucella, understanding the Brucella picture in the regions and in the U.S. And so I point folks to Deb and from the bigger context from Brucella. But Forrest, do you want to add anything on that?
No, I don't think so. You know, other than that, this is why the follow-up, just all the dead animal data is just so crucial. And the more that we can get that to help answer these questions.
Yeah, absolutely. That's such a good point. And we didn't talk a whole lot about that, but the dead part of the investigation and what was recovered during the NERDA and after the spill was so important. And, we haven't had as much support from the stranding network. I shouldn't say support, that's the wrong word. We haven't had as much recovery of bodies from Louisiana to really help answer the current questions and what's continuing to happen. And it is so important. So it'd be great to see an enhanced stranding response in Louisiana so that we could continue to study the health of the animals through the dead bodies and what they can teach us. Good point.
All right, and that is all the questions we have time for today. I just want to say thank you to our speakers and thank you all for joining us. You will be able to find this presentation on YouTube later this afternoon. Thank you all again for being here and have a great rest of your day.
Thank you for having us.
Thank you guys. Great job.
Thanks.
Thanks.